presentation on bloodborne pathogens. Thank you for doing your best to learn this important information. Disclaimer. This training will satisfy the training requirements for initial employee training and is required annually thereafter. For employees who work with cultures of HIV, hepatitis B, hepatitis C, human blood, or other potentially infectious material, or OPIM, known to be infected with the above bloodborne pathogens, this will only serve as an introductory training and will not satisfy the additional requirements for working with these specimens. For additional training on working with human blood and OPIM, contact your supervisor. By the end of this unit, you will have an understanding of types of bloodborne pathogens, bloodborne pathogen transmission, exposure control plan, personal protective equipment, HBV vaccination, emergency response, and medical record keeping. Know your risk of bloodborne pathogen exposure and the types of pathogens you may encounter. Here's what you'll need to know. The definition of bloodborne pathogens, who is at risk for exposure, who is covered by OSHA's bloodborne pathogen standard, and the types of bloodborne pathogens. Bloodborne pathogens are disease-causing microorganisms that can be present in blood, bodily fluids, and tissues, and cause serious life-threatening diseases in humans. These pathogens include malaria, syphilis, brucellosis, hepatitis B, called HBV, and hepatitis C, called HCV, and the human immunodeficiency virus, or HIV. The bloodborne pathogen standards of the Occupational Safety and Health Administration protects employees with occupational exposure. Occupational exposure means that the employee could be reasonably anticipated to come into bodily contact with blood and other potentially infectious materials, or OPIM, while performing their job duties. The standard mandates safeguards and training requirements. The standard does not cover those who engage in Good Samaritan acts, such as assisting a coworker with a nosebleed, because these are not considered to be occupational exposures. Millions of employees, particularly those in the healthcare, dentistry, and hospitality industries, are at risk for bloodborne pathogen exposure. These include physicians, nurses, emergency room personnel, orderlies, housekeeping personnel and laundry employees, dentists and other dental employees, laboratory and blood bank technologists and technicians, medical examiners, morticians, law enforcement personnel, firefighters, paramedics and emergency medical technicians, home health care employees, and anyone providing first response medical care as part of their job duties. The hepatitis B virus, or HBV, is a common bloodborne pathogen that attacks the liver, causing inflammation. It may cause fever, jaundice, abdominal pain, nausea, vomiting, loss of appetite, fatigue, or in rare cases, death. The disease may last just a few weeks, but in some cases can become chronic or long-term. Chronic infections can lead to serious conditions such as cirrhosis or cancer of the liver. The virus transmits through sexual contact or exposure to infected blood, or OPIM, such as blood on needle sticks or an infected person's open sore. The virus can be transmitted by carriers, meaning infected people who have no symptoms. The virus can survive outside of the body for up to 7 days, so even dried blood presents a risk. There's no medication available to treat HBV, meaning it has no cure, though people do recover on their own and they never become infected again. The virus does have a safe, effective vaccine available that is usually given as 3 or 4 shots over a 6-month period. The hepatitis C virus, or HCV, is another common bloodborne pathogen. HCV has symptoms that are similar to HBV, including jaundice, fatigue, and abdominal pain. Frequently, in about 3 out of 4 cases, HCV leads to a chronic infection and liver disease, which may be life-threatening. HCV has no cure or vaccine, though medications can suppress the virus and new treatments are showing promising results. 1/4 of those infected will recover on their own, but unlike HBV, they can become reinfected. As with HBV, it can be transmitted by carriers. The virus can survive outside the body from 16 hours up to 4 days. The human immunodeficiency virus, or HIV, attacks the immune system and weakens it so that it cannot fight other deadly diseases. HIV causes acquired immunodeficiency syndrome, or AIDS, a disease with no known cure, although treatment is improving. The HIV virus is very fragile and will not survive outside of the human body for more than a few hours. Symptoms of HIV infection may vary, but it often causes weakness, fever, sore throat, nausea, headaches, diarrhea, weight loss, swollen lymph glands, and a white coating on the tongue. Bloodborne pathogens are present in many different bodily fluids and can enter the body in various ways. Here's what you'll need to know: fluid and tissue pathogen sources, and common routes of entry. Generally, bloodborne pathogens are transmitted through contact with infected human blood or fluids contaminated with infected blood, such as saliva. Other potentially infectious materials, or OPIM, include vaginal secretions and semen, cerebrospinal fluid from the brain or spinal cord, synovial fluid, which is present in the cavities of joints, pleural fluid from the chest cavity, peritoneal fluid, which is present in the abdomen, amniotic fluid, which surrounds a fetus in the uterus, unfixed tissue or organ from a human, living or dead, any blood, cultures, or animal tissue intentionally infected with or containing HIV, HBV, or HCV. Common routes for bloodborne pathogen entry include a splash or splatter of human blood, or OPIM, coming into contact with mucous membranes, such as the eyes, nose, or mouth. Entry directly into blood or muscle tissue via an injection from a needle or cuts from other contaminated sharps, such as scalpels or broken glass. Contact with exposed, broken skin. Unbroken skin forms an impervious barrier against bloodborne pathogens, but sores, cuts, and scratches, abrasions, acne, blisters, or other cracks can allow infected blood to enter your system. The Exposure Control Plan, or ECP, is designed to eliminate or minimize employee exposure to bloodborne pathogens. OSHA requires that employees have access to the ECP and the state's bloodborne pathogen regulations. Here's what you'll need to know: the components of an exposure control plan, training requirements, and engineering and work practice controls. The ECP identifies the jobs and tasks with potential occupational exposure to blood or other potentially infectious material. It includes guidelines for the following: training, engineering and work practice controls, including universal precautions, personal protective equipment, or PPE, to be used, post-exposure evaluation and follow-up plans, medical surveillance, vaccinations, signs and labels that communicate hazards. The ECP will be reviewed and updated annually. During the review, employee input will be solicited on the effectiveness of current engineering and work practice controls to control hazards. Bloodborne pathogen training is required at the following times: at the time of the initial assignment to a job with possible exposure to bloodborne pathogens, annually, and when existing tasks are modified or new tasks are required that affect your occupational exposure. Engineering controls reduce exposure by removing the hazard or isolating the employee from the hazard. This is the most effective way to control exposure to bloodborne pathogens. Examples of engineering controls include medical safety devices with engineered sharps injury prevention features and sharps disposal containers. The following medical safety devices are examples of engineering controls. Self-sheathing needles are needles with sheaths, or covers, that can be slid back over the needles after use. The sheaths lock into place. Self-retracting needles retract into the syringe after use. Needleless systems are devices that do not use needles for the collection and withdrawal of body fluids, or for the administration of medication and fluids. Examples of needleless systems are jet injectors and Luer taper systems. Single-use scalpels have shields that slide over the blades after use. Sharps are objects that can penetrate skin, such as needles, scalpels, broken glass, capillary tubes, or the exposed ends of dental wires. Potentially contaminated sharps must be disposed of in a sharps container immediately after use to reduce the likelihood of exposure to bloodborne pathogens. A sharps container must be readily accessible and kept as close as possible to where sharps are used. They must also be read or labeled with biohazard signs. The sides and bottoms must be leak-proof. They must be puncture-resistant and closable. Always follow safe practices. Keep the container upright to prevent any sharps or liquids from spilling. Regularly inspect the container and replace it when it is 2/3 full. Close the container before moving or replacing it. If leakage is possible, transport the sharps in a secondary container. Dispose of the sharps containers as regulated waste, following local and federal requirements. Regulated waste items require special handling. They include blood, or OPIM, in a liquid or semi-liquid form, contaminated items that could release blood, or OPIM, in a liquid or semi-liquid state if compressed, items with dried blood, or OPIM, that are capable of releasing these materials during handling, and contaminated sharps. Place regulated waste in closable, leak-proof containers. These are constructed to contain all contents and prevent leakage of fluids during handling, storing, transporting, or shipping. They must be appropriately labeled or color-coded. Close containers prior to transport, storage, or handling to prevent spilling content. If contamination occurs outside the container, place them inside a secondary container for storage, shipping, and transport. Dispose of all regulated waste in accordance with federal, state, and local regulations. Work practice controls reduce the likelihood of exposure to bloodborne pathogens through processes. The following are recommended controls. Cover any cuts or abrasions, especially those near your hands. When a potentially infectious material is present, don't touch your face or mouth, eat, drink, smoke, or apply cosmetics, including lip balm. Finally, follow universal precautions. Always follow universal precautions to avoid exposure to bloodborne pathogens. Treat all human blood, or OPIM, as if contaminated with bloodborne pathogens. Treat all materials with human blood, or OPIM, as if contaminated. Minimize handling and manipulation of contaminated materials. Handle sharps carefully. Injury from contaminated sharps, such as broken glass or needles, is one of the primary routes of entry of bloodborne pathogens. Use forceps or another device to pick up sharps. When handling needles, do not bend or break them. Do not recap them, and be sure to place them in a sharps container as soon as possible after use. If a sharps injury does occur, report it to your supervisor and record the incident in the sharps injury log. When handling human blood, or OPIM, do not store food and drinks in the same refrigerator or workspace with specimens. Label the storage space of the specimens with the biohazard symbol. Minimize the creation of droplets, splash, or spray. Use secondary leak-proof containers for storage and transportation of containers of human blood, or OPIM. Decontaminate all equipment that may have come into contact with human blood or OPIM prior to shipping or servicing. Biohazard warning labels must be placed on the following: containers of regulated waste, containers used to store, transport, or ship blood or OPIM, refrigerators, freezers, and other storage locations that contain blood and other potentially infectious materials, laundry containers being sent for cleaning, sharps containers. Decontaminate work surfaces with an appropriate disinfectant after the completion of any procedures involving blood or OPIM, when surfaces are contaminated with infectious materials, and always at the end of the work shift, even if there is no visible contamination. Follow instructions on the product label for dilution, contact time on the surface, and required PPE. If a spill occurs, cordon off the area. Put on the required PPE. Place absorbent materials, such as paper towels, on the spill. Pour disinfectant on and around the spill area, allowing the disinfectant to flow into the spill. Allow the disinfectant to sit for the required contact time. Collect the absorbent material, wipe up excess disinfectant, place the absorbent material and disposable PPE in a biohazard bag to be disposed of as regulated waste. Hand washing is one of the most important practices used to prevent the transmission of bloodborne pathogens. Wash hands or other exposed skin thoroughly as soon as possible after an exposure incident. Also, wash hands after removing PPE. Use antimicrobial soap. Do not use harsh or abrasive soap. An alcohol-based hand rub may be used if the hands are not visibly contaminated. In potential exposure situations, always wear PPE appropriate to the task. Here's what you'll need to know: the purpose of PPE, PPE use, and removal and cleaning procedures. If blood or OPIM could splash, spray, or otherwise contact the eyes, nose, or mouth, use face shields or masks in conjunction with eye protection, such as goggles. For mouth-to-mouth resuscitation, use mouth barriers or CPR masks. Other PPE that may be useful when working around blood or OPIM includes gloves, gowns, aprons, laboratory coats, boots, or shoe covers. Assure that the PPE fits. Inspect the PPE before use, and do not use any PPE that is torn, punctured, or soiled. It must be replaced. Remove PPE prior to leaving the work area so contamination is not spread to other areas. Follow universal precautions when removing PPE. Be careful not to contaminate other areas. Wash hands immediately after the removal of PPE. Contaminated laundry is either soiled with blood or OPIM or may contain sharps. Remove PPE and contaminated clothing as soon as possible. If the PPE and clothing is reusable, place the items in approved and labeled laundry bags or biohazard containers. Do not rinse or sort them first, and never take them home to launder. Laundry personnel can reduce their exposure with the following guidelines. Handle the laundry as little as possible. Water-soluble bags provide the greatest protection because they will dissolve in the washing machine, thereby minimizing handling of contaminated items. If the laundry could soak through the container, place it in a secondary container and label it with the biohazard symbol. Do not hold the laundry bags close to your body or squeeze them because they may contain sharps. Wear the appropriate PPE for handling the laundry. Vaccinations serve as another level of protection. The HBV vaccine series consists of 3 shots which build immunity to HBV. Here's what you'll need to know: guidelines for hepatitis B vaccination, and the guidelines for opting out of vaccinations. The vaccine is offered to all employees at risk of exposure. The vaccine is free and performed by a licensed professional. It needs to be administered within 10 working days of the initial assignment. It should be at a reasonable time in an accessible location. You do not have to be vaccinated if you have already been vaccinated, and antibody testing reveals your immunity, or you opt out after being offered the immunization. If you decline the vaccination, you must sign a declination form. It is possible to initially decline and later accept the vaccine. A bloodborne pathogen exposure incident involves either an injury or contact between blood, or OPIM, and a vulnerable part of the body, such as the mouth, the eyes, mucous membranes, or broken skin. If an exposure occurs, wash the exposed area thoroughly with soap and running water. Use non-abrasive antimicrobial soap. Flush the nose, mouth, or skin with splashes of water. Irrigate eyes with water or saline. Report the exposure immediately. Seek medical attention. After the immediate response steps, further follow-up is necessary. The employer will provide an immediate, confidential medical evaluation and follow-up at no cost. The employer must obtain consent from the source individual and the exposed employee to test the blood. After consent, blood testing should occur as soon as possible after the exposure incident. If medically indicated, the employer will provide risk counseling and post-exposure protective treatment for diseases. The employee and employer will both receive a written opinion of the findings within 15 days of the evaluation. As previously discussed, preventative medical treatment for HBV is available. For every exposure incident, the employer must document information about the incident and the source employee. This information will be kept confidential and will not be disclosed or reported without the employee's written consent unless required by law. The following information will be recorded: the name and social security number of the employee's hepatitis B vaccination status, including the dates of vaccination, the results of examinations, medical testing, and post-exposure evaluation, follow-up procedures, information provided to the healthcare professional, the healthcare professional's written opinion. In summary, always know what hazards you are working with. Know and follow the written exposure control plan and complete all training. Always follow universal precautions, treating all blood and OPIM as if it's infected with bloodborne pathogens. Use proper PPE. Report all suspected exposures immediately. Don't handle sharps or broken glass with your hands. Never fill a sharps container more than 2/3 full. Read labels on the handling of decontaminants prior to use, and properly dispose of contaminated waste, PPE, and sharps containers as regulated waste.